NBC's chief medical editor, Dr. Nancy Snyderman, to see all the details on that. I used to think if you're saving money, it's a good idea, but that's apparently not always the case.
Yeah, we sure know it's a big business because generic drugs right now account for nearly 70% of all prescriptions given to patients, and most of the times they're safe, but there are instances when they may not be.
I was with my babies, and I felt one coming on, so I grabbed both of them, and I put them in a crib. I went down to my knees, and I went to grab the bars of the crib, and that was the last thing I remember.
22-year-old Stephanie Bornese suffers from epilepsy. Every day, she takes Trileptal to keep her seizures under control.
I take 5 pills daily. My Trileptal for 1 whole month are about $1,000.
For nearly 3 years, the Trileptal had been working. But when a cheaper generic version became available, the pharmacy switched Stephanie to it.
As soon as they switched me to that, I had a seizure within a month.
Dr. Jacqueline French was Stephanie's doctor at the time.
She is very sensitive to drug switches, so the culprit was pretty clear in that case.
The FDA requires a generic drug to be identical or bioequivalent to its brand name. But the amount that ends up in the bloodstream can range between 80 and 125% of the brand.
That is enough of a variation that for drugs where you need a very narrow specific concentration in the bloodstream, a generic might be just different enough to cause a clinical problem.
Pharmacist Alan Schnorr agrees.
There are certain drugs that have a narrow therapeutic index. Those drugs I personally always try and dispense brand. I'll even try and tell the people or call the doctor.
But he doesn't have to, unless a doctor specifically indicates brand necessary or dispense as written on the prescription. Most states allow pharmacists to substitute the generic drug. The rest of them mandate it. Still, that's not what concerns doctors the most.
Generic switching is what we are most concerned about. Not even brand to generic, but generic to generic switching.
I can bring up a generic on the screen and have a choice of 5. And sometimes I will pay a little more for a certain generic than the other because they're all different prices.
So much of the generic push seems to come down to the nickel and dime aspect of it,
Right.
saving money.
Yes.
Who is in it to save money?
The insurance companies are definitely in it promoting the lower copays, but the people also want the lower copays.
As for Stephanie, she's lucky. Her insurance company is once again paying for her brand medication, and her copay is just $4.
So Nancy, let's go over this again. The FDA's requirement is that the generics be identical or bioequivalent to the brand name, but that only has to do with active ingredients, and inactive ingredients can be different.
Yeah, so the active ingredient is the thing that just hopefully makes you stop seizing or makes your heart be under control. But the inactive is the filler or the stuff that holds it all together. And the unanswered question is, does that inactive ingredient play a role in how that active ingredient works? And bioequivalent does not necessarily mean identical. And even if you switch from one generic to another, there can be differences.
Let's bring Lucy Danziger in right now, who's the editor-in-chief of Self Magazine. It features this topic in the current issue. Lucy, I mean, let's go back to what Nancy said in the introduction. Right. Most times switching to a generic is fine. But what's the headline in this article?
All right. Well, Self conducted an investigation where the FDA admitted they don't have the budget to inspect all the manufacturers or test every pill. So not all pills are created equal. And if you're having some side effects, you have to go back to your doctor and ask for the brand name because there's a huge difference.
You kind of like to use the analogy of Diet Coke and Diet Pepsi.
Wine is all created from grapes. Cola is cola. But you wouldn't walk into a restaurant and say, just give me whatever you want to give me. I mean, people have differences and preferences, and your body chemistry is going to react differently to those inactive ingredients.
Are there other, Nancy, conditions out there, for example, like epilepsy that we just saw in the piece, where people should be particularly vigilant in figuring out if they're getting one generic or another, or a brand name or a generic?
Anytime you get something, a prescription filled, and you feel funny suddenly things are different, your heart's not right or you're having seizures, you have to go back to your pharmacist first and say, is this the same thing? When I talked to Alan Schnorr, the pharmacist here, I said, what about sleeping pills? Because a lot of people take Ambien particularly, or one thing like it from when they're traveling, and he said, absolutely, he can tell when a new shipment comes in from a different manufacturer. People come and go, I just don't think it works. In the pediatric population, we've known for a couple of decades that some pediatricians will say, do not substitute, because the margin of error in a 40-pound child is so narrow compared to an adult. So I think this is an ongoing problem, and the FDA doesn't have the money, doesn't have the time, is too
do they have
scrambled.
The reach either?
They
Because
don't
they
have
approved
the
600 new generic
Right.
drugs last year. Many of those are made in factories out of this country.
And as you know, the FDA has now set up shop in China, in India, in Europe, because they realize we have a global situation on our hands when it comes to these things.
So we at Self-Save, buyer beware. It's great to save money unless it costs you your health. And there's a whole list of antidepressants and acne medicine and thyroid medicine you can find on our website that has had a history of problems. So you really have to be buyer beware.
But I didn't have an idea. I did not realize that the pharmacist can just switch you from generic to generic without you knowing it.
In fact, the prescription pad you saw in that piece was mine. And I sat down and really looked at it, and I looked at the fine print. Because I usually just say, do not substitute. It says, doctor must write out, do not substitute. That means I can't just check a box. And otherwise, yes, in most states, anything can be substituted, and you, as the patient, may be the last person who knows.
All right, Nancy and Lucy, thank you both very much.
Thanks for having me.
Good to have you both here.